So good evening, ladies and gentlemen. Thank you so much for joining us tonight for this panel discussion about anxiety following the showing of the film Angst. My name is Andrea Smith, and I will be your moderator this evening. I just would like to thank the Howe Library in partnership with Circle Up for sponsoring and supporting this event for the community. We're very grateful, and we're really excited for this discussion. So now I'd like to introduce our panelists for the evening. First up, we have, and I tried to, if you can see on the screen, I tried to list all of the panelists, just put that word in front of them. So as you're looking through our little Hollywood squares, you'll see their names. So first up, we have Chief Jennifer Frank. Chief Frank has over 15 years of law enforcement service and is currently serving as the Chief of Police for the Norwich, Vermont Police Department. She previously served as a special investigator under the New Hampshire Attorney General's Office for the Plymouth State Special Investigations Victim Services Unit. She later transitioned to the Windsor, Vermont Police Department, where she attained the rank of detective and served as a school resource officer for Windsor schools. Chief Frank earned her Doctorate of Education and Masters of Educational Leadership at Plymouth State University and has been awarded both the Vermont Law Enforcement Officer of the Year and the New England Region Officer of the Year awards. She has an extended history of working with juveniles and diversion programs and runs a 4-credit police cadet program for youth interested in a future career in law enforcement and a school safety program for younger youth. Next up, we have Dr. Bill Hudenko. Bill Hudenko has significant experience in the fields of both mental health and technology. Dr. Hudenko is a licensed psychologist, a researcher, and a professor who holds a joint appointment as a faculty member at Dartmouth's Department of Psychological and Brain Services and Dartmouth's Geisel School of Medicine. His research focuses on the use of technology to improve mental health delivery and patient outcomes. Dr. Hudenko is also an experienced software engineer and former database administrator for the National Center for Post-Traumatic Stress Disorder. Dr. Hudenko is currently the CEO of Trust Health, Inc., a company devoted to providing high-quality, affordable remote psychotherapy via messaging. Dr. Hudenko is a former CEO and current Chief Science Officer of Voy, Inc., a company dedicated to reducing suicide rates through the implementation of technology and artificial intelligence. Dr. Hudenko is also the former CEO of Incente LLC. Prior to his work at Dartmouth, Dr. Hudenko was a professor at both Ithaca College and Cornell University. Dr. Hudenko has a broad expertise in clinical psychology with an emphasis in child psychopathology and family systems. He received his BA from the University of Michigan, his PhD in clinical psychology from Vanderbilt University, and his postdoc from Dartmouth College. He has a wife and 2 young girls, 6 and 8, and lives here in Lyme, New Hampshire. Next up, we have Willie Johnson. William Johnson is a weekly academic advisor at Hanover High School, where his main focus is to assist students individually with workload planning and executive function skills. Additionally, Willie is a 3-sport coach also at Hanover High School, coaching boys soccer, basketball, and tennis at the JV level. His background prior to being the school's weekly academic advisor was as an art teacher and special education assistant and has worked within SAU 70 since 2013. He is originally from Hanover and graduated from Hanover High School in 2005. And finally, we have Chris Seibel. Chris is a licensed clinical mental health counselor and a master-level drug and alcohol counselor who has over 30 years of experience in the mental health field. For the past 16 years, Chris has worked as a school counselor at Hanover High School. And again, my name is Andrea Smith, and I am your moderator tonight. I am a Community Health Partnership Coordinator in the Population Health Department at Dartmouth-Hitchcock Medical Center. So before we get started, if you were not able to catch the film last week, I just want to give you a quick overview. Angst is a film and virtual reality experience that explores anxiety, its causes, effects, and what we can do about it. The filmmaker's goal is to have a global conversation and raise awareness around anxiety. Angst features candid interviews with kids and young adults who suffer or have suffered from anxiety and what they've learned about it. The film includes discussions with mental health experts about the causes of anxiety and its sociological effects, as well as help, resources, and tools. So with that being said, I'd like to start off the discussion by asking our panelists to share what they thought of the film and why it was helpful. So first, Dr. Hudenko, would you like to start us off?
Yeah, sure. Thanks everybody for having me. Look forward to having this conversation. I mean, generally I'd say I really liked the film. I mean, my big the thing that I really loved about it, frankly, was how they used adolescence so adroitly to help a lot of different people understand the experience of anxiety. And I think in particular for youth, it's just a fantastic film for them to level set and understand that anxiety comes in different forms and there's things you can do about it to help yourself. So and I love that. And I think they were spot on with some of the techniques that we use. And I'm looking forward to talking more about even other things you can do.
Great, thank you. And Willie, how about you?
Interesting. Bill hit on some key points that I also liked about the film, and that it being mostly about teenagers is the age of students I work with. So that was really kind of great for it to be oriented in that way, because it felt very to what I do. Also, the fact that they have some real ways to diffuse anxious moments. And again, also, I think it's just something that is really powerful to hear other people's stories, to not feel alone in these moments where, for those who are really anxious, those are the hardest moments, when you have to feel alone in this sort of feeling that you have. So I think that just bringing awareness to people, and to both people with anxiety and without anxiety.
Great, thank you. And Chief Frank, can you share with us what you thought of the film and why it was helpful?
I had some similar reactions. In particular, I appreciated that not only did it raise awareness, but it was relatable. You really could feel that you understood and were working through the experiences together. It also allowed some people to be able to give a name to some of what they're feeling and recognize they're not alone in that process. I think there's real value to understanding a shared community experience and having actual things that you can take and put into place that may be useful for you down the road.
Great, thank you. And finally, Chris, can you share with us what you thought of the film and why it was helpful?
Yeah, good evening, everyone. I think it was important that the film talked about anxiety in a way that everyone experiences anxiety at some point, but not everyone experiences anxiety or an anxiety disorder. And I think that's helpful for parents to understand that when their child presents as being anxious, that it's, due to the level of impairment, it's not a typical bout of an anxious feeling that you kind of move through. So I think the film did a nice job making that point. I also like the way it provided hope, that it showed some real practical type of interventions that young people and old people alike can take in dealing with anxiety. Working in the field, it's still eye-opening to hear that 1 in 8 high school students meet the criteria for an anxiety diagnosis. And so if we think about that at the high school, that's 2 to 3 people in a classroom. It could be as many as 4 or 5 individuals in a sports program. So the adults in our building will come in contact with young people with an anxiety disorder, and it's important to, have a sense of how to support students when they're experiencing heightened anxiety.
Great, thank you. So with that, we will jump into our first question. So Dr. Hudenko, I'm wondering, can you tell us, is anxiety on the rise, or are we just more aware of it?
Prior to COVID, I would say maybe we're just more aware of it. But I think there's a lot of interesting and disturbing evidence out there about an increase in mental health problems, in particular in response to COVID. The scariest statistic that I heard recently is that the CDC reported that up to I think it was a quarter of all youth between 18 and 25 have experienced suicidal ideation in the past month. So, whether that statistic is accurate or not and how that has changed, I don't know exactly, but I can say that I think that in the current environment, it makes sense that there's a heightened amount of anxiety at a population level. And I think that what we know about the onset of these disorders is that there's often what we call a diathesis stress model, which just means that if somebody has a genetic diathesis or a predisposition for a disorder, and then there's enough environmental stressors, it may trigger the onset of that condition. And so at a population level, with all of the incredible uncertainty that has happened over these past 6, 7, 8 months, I think that it is likely that we're going to see an avalanche of mental health need that is only starting right now and will have effects over the next year and more. So I think the general answer is, before COVID, it was questionable if it was just more awareness and we saw the same base rates. And I think right now we're definitely seeing an increase across a number of different conditions, and anxiety being one.
Mm-hmm. Thank you. And I'm glad you brought up COVID. I have, like Liz said in the chat, I apologize, I didn't say this before. So I do have several questions prepared for our panelists, but again, please feel free to ask questions throughout the chat. I don't know that we will be answering them, live as you're asking the question, but again, we did save some time towards the end to be able to ask those questions. So feel free to throw those in the chat. But I am going to touch a little bit later, ask some of the panelists to talk about what they're seeing related to anxiety and COVID. So I'm glad you brought that up. But my next question for you, Dr. Hudenko, again, is, the film talked about the difference between somebody just having anxiety and just being anxious. So can you tell us a little bit about the difference? How do I know if my child has anxiety or is just anxious?
Yeah, I did really like that aspect of the film, really helping to distinguish that anxiety is something that we all feel. It's natural and adaptive, and it's, it is meant to help us perform and to prevent problems. So all of that is good. And so a lot of it really comes down to what would we call abnormal. And it's funny that we're having this conversation, because I actually had my last class today teaching Dartmouth undergrads abnormal psychology. So I feel well prepared to answer this question. So the basic definition of what we call abnormal has one of 3 criteria. So either something causes significant distress, significant impairment, or risk of harm to self or others. So if any one of those 3 criteria might be sufficient in order for someone to have a diagnosable mental illness. So in the category of anxiety disorders, we're generally talking about conditions where more often than not, it's stress, it's distress or impairment that the individual feels that is beyond what we would expect in the normal population for somebody in terms of levels of anxiety. So that is a bit of a clinical judgment, and it really depends very much on the severity. So if somebody's experiencing anxiety that's so crippling that they are refusing school and they're not able to attend classes and they're not getting out of bed, it's really very clear. And most people understand, okay, this child has an anxiety disorder, or adult. In the case where it's borderline is where those diagnostic decisions are hardest. So those are the cases where, yes, the person is more anxious than most people, but is it really causing impairment? Are they having other ways to compensate for it? Those are the times when clinicians, I think, are most important and relevant for helping people to make that determination about what is normal, only because we see so many people and can have maybe a sense of what would be typical for someone that age.
Great, thank you. And Dr. Hudenko, in the film, I don't remember the doctor's name, but she talked about when she would diagnose somebody with anxiety, she would often ask, which of your parents in the home has anxiety as well? Which parent has the really clean house, or, something like that. So I'm just curious, can you talk to us about how much of the anxiety in our kids is genetic?
Well, it does. There are differing rates depending upon the exact disorder that you're talking about. So whether it's generalized anxiety disorder or social phobia, they all have different genetic penetrance or heritability. However, as a general rule, we talk about somewhere between 40 to 50% of it might be genetically heritable. And I think there was a slight overstatement in the movie about, every child has a parent who has it and that you'll always see it in the family. But the point I think she is making is that, yes, there tends to be a genetic component to it. And a lot of this actually stems all the way back to research that was done on temperament. And a lot of people, the idea of temperament is that we have a genetic predisposition, even as infants, in order to respond to stimuli in certain ways. And one of the kind of temperaments that young children have is called harm avoidance. So harm avoidance just means that a very young child will range on a spectrum of how likely they are to fear stimuli or potentially avoid harm in their world. So we know that there's actually a fairly strong linkage with this temperamental characteristic and anxiety disorders. And I know, even from my own child, how one of my children was born harm avoidant and one was not. And the harm avoidant child took a long time to decide to go down a slide. And my other child has hit her head so many times I can't even count because she has no fear. So we know that there's these genetic components that will increase the chances that someone will have a heritable actual disorder.
Great, thank you. So Chris, my next question is for you. So, after hearing about the prevalence and Dr. Hudenko's thoughts on that and the science behind it, why do you think it's so hard to talk about anxiety and mental health when it's affecting our entire community?
Right. Just to play off a little bit of what Dr. Hudenko mentioned about, temperament. Years ago, we had our evening presentation with parents, and it was related to risky behaviors. And I tell a story of, I have 3 daughters, and when the oldest was 9, she was on a school bus with her younger sister who was 5. And I was coming home from work, and their bus, it was snowing out, had slid off the road. And I pulled over, and the bus driver relayed that the second bus came by and picked up the kids, and everyone went home, and everyone was okay. I continued home. When I came into the door, the 9-year-old, I can hear her as soon as I come in, just her footsteps running towards me. And Dad, did you hear what happened? And she was all charged up, and I played along and said, what happened? And she said, the bus slid off the road. We got pinned up against the trees. We almost tipped over. And she is just so excited relaying this story. We couldn't get out the door. They had to open up the back, and we got to jump off the bus. She was just so excited. So we said, okay, and she went her way. And then her younger sister, the 5-year-old, was on the bus. She came into the room, and she had her blankie. She's 21 years old now, and she still has the same blankie. But she comes into the room, and she said, Dad, did you hear what happened? I said, yeah, Hannah said something with the bus. And she said, something with the bus? We almost died. I said, oh, okay. And she went on to tell me how, it slid off and it was snowing, and why would Mom and Dad, why would you guys put us on a bus when it's snowing out? And she was all nerved up, and I tried to kind of assure her that everything's okay, and she went along her way. And then the 3-year-old heard the story, and she came flying and said, Dad, guess what? And I said, the bus slid off the road. She goes, no, when I get older, I'm going to be a bus driver. And she was all hyped up and excited. So, the same kids, same family, same family, same parents, same parenting style, but their temperaments were very different. And I think part of the role as a parent is to understand that. And for a couple of my kids, it meant kind of dampen down their risk-taking behavior so that it wasn't going to be in a way that it was harmful, to get them involved in risk, healthy risk-taking. And then for the middle one, it was kind of pushing them away and giving them some more independence so they could manage that a little bit more. And to your question about the anxiety and mental health, are we talking about enough in our community or as a whole across the nation? I would say, with having a 30-year career in the mental health field, we're doing a much better job as far as talking about mental health today than we ever have. And it still has a stigma, mental health, but I think there's more efforts, especially at the school level. A lot of schools are putting resources into counselors and mental health counselors to work with students to help them manage some of the challenges of being teens. And at our own high school, we have a club, End the Silence, which has been operating the school for about 20 years now. And during that time, the club's main focus has been on suicide prevention. But over the past 3 years, the club has shifted, attention to all matters of mental illness and have organized a number of events, ranging from community walks to raise awareness about mental health to a school-wide assembly about Judge Broderick's Change the Direction program. And his program specifically addresses the stigma around mental health and how that prevented him from accessing care for his son sooner. So I'm actually, I'm pleased where I see things now compared to how they were. We do have a ways to go. But, I guess the last thing I'll mention about the high school and kind of destigmatizing mental health or mental illness is the students in the End the Silence group wrote a grant and then used the grant money to work with 2 local clinicians to train both students and staff on mental health first aid. They also trained a number of coaches. So yeah, the stigma exists, but I think young and old alike, we're doing a good job trying to address it in a way that we're taking that stigma away. And I think in large part, young people are leading the way. I find that young people have more of a comfort level talking about their mental health.
Great, thank you, Chris. And thank you for sharing that story about your daughters and the bus. So Willie, my next question's for you. So you and I have chatted a little bit offline about having some personal experience with anxiety. So I'm just wondering if you can take a couple of minutes just to share why you wanted to be a panelist on this related to talking about anxiety, just sharing briefly your experience, and then if you can give us some suggestions on how we maybe can manage our daily stress and anxiety.
Sure. And so one thing that before I go into my whole experience, I will want to mention Chris has been doing a great job too with the new reform at the high school. We've been doing an advisory circle, and I know he's an architect of that. I just want to give that out to him. And part of the discussions we've been having at the high school actually has been able to let me share my experiences with my students. And, talking about what is the culture like at Hanover High School, what is their personal feelings about what parents and adults should know, have been really powerful conversations, which I think my insight of having been a student at Hanover High School and having had anxiety and panic attacks, it's something that I feel like I'm able to give back. And in a lot of ways, I see from the movie, the concepts behind exposure therapy was a lot of what I kind of forced myself to do in my life, and be a resilient person and face the things that I had a really hard time with. One of my first days working at Marion Cross School, or at Richmond Middle School rather, I remember Suzanne Sylvester, who had also been my 6th grade English teacher, asked me, like, what are you doing here? You hated school. And I think in part, I want to work in education so students don't have the same feeling I did. And I think it's a powerful motivator for me. And in some ways too, it's like the same thing with sports. I'm a 3-sport JV coach, and I never played a varsity game in my life. So there's some amount of that has always been in me and has spurred me in a way that has inspired me to try to work with students and share my experience. And I think for some of them, it is very powerful because I'm from Hanover, and I appreciate the ability that, they have open ears and are able to talk about it in a very authentic way. And I think Chris hit the nail on the head again with just saying that our young people are able to open up a little bit more about this. And some ways about just helping deter those anxious feelings. Like, I think the things that I've found most useful is chunking out into smaller portions, get through the next day. If that's just the thing, if it's not the next day, it's the next hour, it's the next 30 minutes. How do you get better in the next 30 minutes? And then a lot of positive self-talk. I think rumination is something that really hurts for students, and when they get caught on negative self-talk, they destruct and destroy themselves from within, and that's a hard thing.
Great, thank you. I was just taking a couple notes to be able to reference later. Thanks, Willie, for sharing that. I appreciate it. Chief Frank, my next question is for you. So in a high stress career, can you tell us a little bit about how you manage your own anxiety when things get stressful?
Absolutely, and thank you for allowing us to be a part of the conversation. We tend to find sometimes that some of the behaviors that manifest because of anxiety disorders or anxiety processes, oftentimes the police department get called in. I wanted to build off of the last discussion that Willie had brought up, in that we spend a lot of time when we work with people, because we get called to those situations, focusing not so much on what can't be done, but more on what we can do. And I wanted to just take a moment to share that an example of a time where we get called might be for a truancy. And we get called in because of students not attending classes. And sometimes it might be a result of some anxiousness or some other things going on. And we've had an opportunity to work with a lot of students. One student in particular, she did not like the Zoom process. And maybe it's because of the way she appeared or the background or just some of the anxiousness of appearing on video. And so we spent a lot of time saying, what can we do? And so we started the first week of just going on Zoom with no audio and no video. And then eventually we moved up to being able to have audio. And I recently spoke with her social studies teacher last week, and she just turned on the video. Didn't say anything, but the video was on and you could see a face. And so from a police department standpoint, a lot of times what we're working with is trying to drill down from the behaviors or manifestations that we get called to, of trying to find out there might be some greater things beyond that, and how we can be a support and a resource for that. We utilize that in our own daily lives as well. And in today's COVID pandemic, a lot of the things that your average person uses to help cope with anxiety or high stress situations are gone. Going to the gym or having an opportunity to get together with friends. And so we've really had to work on some different creative aspects of saying, how can we supplement these experiences with some other tools and resources? And we've had some neat opportunities to do some digital connections and communications with people. Or even sometimes, for example, we have our seniors who can sometimes become isolated as well, which can start to trigger some concerns. It's something as simple as being able to leave a handwritten note on the front door that somebody can come back and say, I see you, I hear you, I know you're there, you're valuable, and you're important. And for my police officers as well, that's something that we've really been utilizing with each other.
Great, thank you so much. Just jumping around to my questions here. So Chris, this next one is for you again. I'm wondering, what do you think are the top 3 things that we should look for in our children or kids that are in our household, maybe including physical symptoms, and how should we as parents, caregivers, guardians respond?
So I'll focus on high school students. That's where the majority of my work is right now. But the 3 things I would focus on would be, one would be avoidance. How much of your child's daily life are they avoiding? Are they avoiding school? Are they avoiding social gatherings? Are they avoiding participating in activities that once brought them joy? Sometimes avoidance can be a result of not wanting to be in a situation that's causing anxiety. The anxiety could be created because of a social dynamic or fear of being judged. And the way that they want to manage that fear or anxiety is to avoid the situation altogether. So that would be one biggie I would look for. I'd also look for self-medication, whether it's excessive social media consumption, substance abuse, gaming. These behaviors can have some short-term gains in terms of distraction or self-medicating the anxiety, but they really have long-term drains. And that's part of the issue with self-medicating is you practice a skill that ends up causing more harm. So if you have a child who you're seeing spending a lot of time in activities that are not pro-social, that would be something that might be a way of self-medicating anxiety. And then lastly, anger. I think I see this often in teens when it comes to their anxiety. They may want to lash out, and oftentimes some young people who are anxious might be seen as being oppositional, defiant, when in reality they're just in a anxious state. And the anger is a good way to push people away. So if there's a lot of, a display of anger from your child, that might also be another a signal that they're wrestling with some anxiety.
And Chris, so, what's your advice to again, parents, caregivers, guardians, if their child doesn't want to talk quite yet, but they can tell that something's wrong? They're displaying this avoidance, this self-medication, self-medicating with these other things you talked about, this anger, but they don't seem to want to talk about it. What can they do? Is there a way that the school can help, or are there other resources that can help these adults?
Yep, there's a bunch of resources available. At times, though, parents will oftentimes feel alone. And I think part of the stigma of when a child has anxiety or a mental illness, parents may inappropriately blame themselves. Like, what did I do? Like, what's my role in this? And so for parents, we want parents to be able to connect with other parents, friends, professionals who will help them understand that what they're going through isn't unique, that it's also something that can be dealt with in a way where the child can get better. I often encourage parents to just warmly express your concerns with your child and use specific examples of your concern. A parent can say, "I'm concerned that you're struggling emotionally because," and then name the behavior. I mean, obviously in a way that's not so that you're not being judgmental. And then, demonstrate with your child that the difference between the normal ups and downs of the teenage years, and what you're observing goes beyond the normal ups and downs. So, a parent could say, I understand a child taking a mental health day from school, but you've missed 8 days this quarter and you present vague medical symptoms that never really need any medical attention. So it's that way of walking with them, and I know as a parent, as a counselor, I can do that. As a parent, I get a little edged up and feel like I have to solve the problem, and so I see it in myself. So I imagine other people who are not trained clinicians, when they're in their parenting role, will struggle with it. But I think it helps me as a parent to understand that there are people I can share the challenges with. And if you're asking your child to be involved in some type of a, intervention to address the anxiety, have solutions readily available that you can offer your child, solutions that have choices. So you might want to go into a conversation, having an opportunity to already have spoken with the pediatrician and a school counselor, and you can, let your child know that, look, I want you to address this, and I've spoken with your pediatrician and your school counselor, and either of them can be available to speak with you this week. I would like you to make a choice and decide which one you'd like to talk to. So it's we call it giving them a false choice, or a forced choice rather, where the hope is they'll engage with someone to support them. But I guess the bottom line for me with parents is be careful of your own shame, because I know I've felt it myself when I think that I've let down my kid or I haven't done enough, and I think sometimes when we feel that shame as parents, in your relationship, you can blame your partner, or they can blame you, or you isolate with them, and it can seem pretty hopeless. So parents need to be comfortable reaching out and asking for some help.
Great, thank you. So Dr. Hudenko, Chris, talked a lot about, if your child or isn't ready to talk about it. But what can I do if, again, my child or a friend or a colleague or anybody tells me that they're struggling? What's the most important thing that I should say or do to help them?
Well, so I just want to add one thing to what Chris said, and then I'll respond to that directly too. But I totally love what Chris said, a number of different points there. And one other thing I think that is so hard about being a parent and helping with a child who has anxiety is that that sometimes the very thing that you want to do to help someone is the worst thing that you can do. I just wanted to add that because one of the things that we constantly try to help parents with, and this will then transition into my answer of how do you help someone, but it is that when you have a child who's struggling with anxiety in particular, the natural inclination is to try to make things easier for them. And so what you'll end up doing is things like, okay, let's take a mental health day and let's not do that and let's avoid this and why don't you not go to the party and X, Y, and Z thing that you're doing out of love and you're doing out of your own concern and your own anything you're trying to do to help that person that you love and care about. And unfortunately, where we're often in the position as clinicians of telling people is, unfortunately, you're making things worse. And the reason for that is, I think that the film actually captured this pretty well about this idea of negative reinforcement, where what's happening is when somebody is feeling anxious and you then remove the anxiety-provoking stimulus from their life, it reinforces the avoidance. And that problem often leads to the increasing of that anxiety condition over time. So one of the first things I like to tell people around help is that it is really good to have an ally in this process and to find somebody who can help you to think through your family role around how to best support somebody, which often means things like you're going to have to do things that your child doesn't like, and sometimes help them confront things. And you do it in, of course, a very gentle way, and you explain why you're doing it and how it's done. But I think that getting the support around somebody that they need sometimes means actually removing your support and having somebody else come in and help them to reframe why they're feeling this way, what they can do, and therefore what resources are available. So hopefully I answered that question, but then also addressed, I think, a common problem that we all experience.
Mm-hmm. Yeah, thank you. That was great. Chief Frank, I want to switch gears a little bit. So my next question is for you. What advice do you have for community members during mental health emergencies, and what supports can emergency responders provide? I know you talked a little bit about the truancy aspect and how emergency responders, how you intervened there, but just again, any other support that you can share that emergency responders provide during mental health emergencies?
Absolutely. One of the things we want to remind folks is that don't wait to call us. Oftentimes people will say, well, I didn't want to bother the police department. It didn't seem like we should bother you. We always want people to know that all of the resources we have are available to people at any time, and not to wait until it's a last resort and you don't know what else to do. We also know that the people that you're working with better than anybody else does. And oftentimes you can help us to know what works, and we can work to build off of that. We provide a lot of just general resources, which can include sometimes transportation. There's an individual who might need to find another spot to be for a short time, might need transportation to a hospital. Maybe they just need someone to talk to, and we can be that liaison to help get that person there. Really, from a community resource standpoint, we always want to encourage folks to do a little pre-work. Come and perhaps meet a police officer before you're in a situation where we're responding because something occurred through that process. We have a really great set of resources. We liaison well. I see that Katie Cormier's on here, and I'm excited to see that. We liaison well with the school and the counseling system and with parents and with DCF and with all the organizations. So we can oftentimes be a go-to to help bring the resources together to try to identify how we can work through these processes together.
Great. And Chief Frank, are there prevention measures that we can that we can take to look out for other members of our community?
Absolutely. There's a common phrase that we'll use in law enforcement, and it's called the see something, say something. And I've heard from several people before, I wanted to reach out to you because I had this concern, or I wanted to do something, but I was afraid to say it, or I didn't want to hurt their feelings, or I didn't want to bring something up. And we really encourage, when you recognize that somebody might be working through something that they could use some additional supports, to reach out to them and acknowledge that and say, if you need, not only if you need something, I'm here, but sometimes being very specific of what that means. It's easy to say, if you need anything, give me a call. But sometimes we find that, especially for those we've dealt with that have identified anxiety disorders or working through that process for the mental health process, they've looked at us and said, I need this very specific thing, and we can provide that. And so from a community resource standpoint, we like to say, yeah, can I help you get to, for example, Dartmouth Hitchcock, or can I help you transition over to Marion Cross? Would you like to ride in the front seat or the back seat?
Great, thank you. So, everybody, all of our panelists have sort of brought up COVID, so I'd like to spend some time, because this has been a great discussion. I'd like to spend a little bit of time just talking about COVID-19 and kind of what we have seen in our youth in the community related to COVID-19. I know Dr. Hudenko talked a little bit about some of the data that he saw. So this is kind of more geared for Chris and Willie. Just what are you seeing in terms of youth in the schools related to COVID-19 and anxiety?
Well, I guess it's an interesting one. So, for example, I think for the most part, students have actually found that there's been a certain level of safety with the measures we have taken. I do think there is an inevitable impact just due to the severity and level of what everything is happening. I do think that the school has taken a good measure in changing our schedule a little bit to mitigate some of the amount of contact and passing that we have. That, that and wearing masks have been reassuring. When, I had a discussion with students just today about our school culture, and one thing that they recognized was the amount of safety and abundance of caution that we have taken in regards to COVID-19. As far as the level of uncertainty, I do think there's still some underlying amount of anxiety from that, but I guess I'll pass it over to Chris. I think he probably might have more insight on this.
Well, I agree with Willie. I was a little bit of a skeptic about our COVID task force plans to reopen school. I didn't think we'd be open very long, but why would I know? I'm not a medical doctor, so it was a matter of trusting the doctors on the COVID task force, and I think they've done an excellent job weighing out the risks, benefits of having children to return to school. It really, I am seeing, my caseload is growing, but I would say it's kind of a low level of emotional distress from our students. I feel like our kids are getting really gritty. I feel like they're facing something. They're utilizing supports. The school pivoted really well in changing their schedule. We have lunch now with our students. They're around adults all day long. There's no free periods. And I think, when there's time to look back on the things that we did as a school, I think we will be pleasantly surprised that we made a lot of really good decisions. And I think I credit that to the task force. I credit that to the educators in the building that have gone to great lengths to really connect with students this year. And so, I'm also hearing a lot from young people about some gratitude, and sometimes, and I know for myself as an adult, there's sometimes, having a scare in your life or losing something, and it makes you count your blessings. And I think that that's something our kids are going through in real time. In our families, it's hard for everyone. It really is. So yes, absolutely, it's hitting our community. It's hitting our young people. It's impacting them emotionally. But I think we're doing a nice job rallying. I think parents are doing a nice job supporting the kids from home, and encouraging them to behave in safe ways so we don't have community spread. And that's been really helpful. Coincidentally, Erin Barnett and Melissa Baker, they're two clinicians at West Central Behavioral Health. They're participating in a Zoom call with me tomorrow that we're going to record. And the topic is COVID and what they're seeing as area clinicians, and they're going to present different type of intervention to support young people. So that's something we're going to, I guess, record tomorrow, and then it'll probably end up in the principal's weekly this Friday. So that could be something that our parents could look forward to.
Yeah, that's great. Liz Powers, I'm actually going to put you on the spot as well. If you wouldn't mind just quickly introducing yourself, and if you could answer that question from your standpoint in the school as well.
Sure. Hi, I'm Liz Powers. I'm one of the school counselors at Richmond School. And I had actually asked Chris earlier this year, like, what are you seeing? Because I think I'm seeing a little bit different things. I want to echo sort of the gratitude that students are expressing gratitude for being in school. I think staff too, that clearly there's some huge benefits, and I am definitely one of the more risk averse staff members at Richmond School. So I was skeptical, but I would say that there are definitely more students looking for support this year. I think the other thing is that I've seen more severe health issues related to anxiety and mental health this year, in terms of more incidents of anxiety, suicidal ideation, eating disorders. Usually the things that maybe there's, a handful of every year, and already we've got that handful and it's only November. So, I think, I don't think that it's caused by being in school. I think, I think it must be pandemic related. But I would say that because kids are in school, they're accessing supports, and that's a really good thing. I think there's definitely been kids who are accessing emergency services. We continue to struggle with access to linking students to counselors in our community just because of access. So I would say overall, kids are very resilient and doing well. They definitely will say to each other, like, you have to wear your mask. We don't want to be going remote. And the fact that they value being in school and they're using that positive peer pressure to make good choices is really kind of cool.
Yeah, that's great.
Can I speak to that from a community perspective?
Yeah, I was going to go to you next. So absolutely.
I just wanted to say we're seeing kind of a different side of it from the police standpoint. One of the things we've noticed is that sometimes there's a lot of question of what is real out there. We've certainly seen the impact of social media and how that is starting to influence manufactured reality versus what we're actually seeing in person. And I bring that up in that when you have an opportunity to interact with people in a social interaction, sometimes you can balance what you see on someone's Facebook page or on their Instagram with what you actually see happening. And what we're starting to notice is because, at least for a lot of our adult population and for some of our students who are heavily on the remote learning, that they don't have that balance right now. And I recently had a discussion with a student with a picture where there's an apple and there's a mirror in front of it, and the apple looks absolutely perfect. But the photo then turns, and so you can see behind the apple, and the part that's not pictured in the mirror has an apple that has a bite in it, and it's all brown on the other side. But all you can see if you just look at the picture that's taken is that beautiful side in the mirror. And so we've really seen that this manufactured reality versus what life is really like, this balance in this COVID era has been a little thrown off for folks. And sometimes that has that increased anxiety that others are coping better, quote unquote, with the experience or having a different lived experience through COVID. And we're seeing the outcroppings of that specifically around our responses to suicidal ideations.
Yeah, thank you for sharing that. I'm glad you brought up social media. That was going to be one of my talking points, but I think you covered that perfectly. Thank you. So Dr. Hudanko. Oh.
Sorry, I'm Katie Cormier. I'm the school counselor at Marion Cross School. I just wanted to speak. I know that this is mainly aimed toward the middle and high school population, as the film was, but just from an elementary school perspective, what we're seeing with kids, it's there isn't as much influx to my door because they're kind of shut off from we're in our zone, so they can't really visit me too often. But I have found it so important to allow the students a time and space to talk about COVID. I think a lot of times, particularly for the young kids, adults or parents in their lives are feeling unsure about what to say or how they should just keep them closed off from everything, and they really are ready to engage in those conversations. Obviously, you want to make sure they're age appropriate, but I think the importance of allowing them to have the space to check in about how they're feeling about COVID, about the change in their reality with COVID, and just how it affects them day to day is so important. So just being a sounding board for them in a positive way is just a really great way to show support for those younger kids who often have a greater sense. Just little kids, I find the younger they are, the more attuned they are with how people are feeling without having to even say anything, without the adults or anybody in their lives having to say anything. So they really pick up on our stress. And so I think if we're willing as the adults to engage in those conversations with kids, particularly the young ones, that can go a long way for their anxiety relief.
Yeah, thank you so much for chiming in, Katie. That was great. So I just have 2 more questions. I know we're running super short on time, but I think this is a great discussion. But I have 2 more questions, and then we will open it up for see if the audience has maybe 1 or 2 questions that we can take. So Dr. Hudenko, my next question is for you. Liz had mentioned, that it's difficult sometimes to link, students with counselors due to access. And I know that you have that's something that you've been very passionate about, that you've worked to kind of create solutions to remove those barriers and things like that, and trust. So I'm wondering if you can just talk briefly about that with the audience so that they are aware of that resource that's out there.
Yeah, sure. So I'll give you a little backstory on this, which would help maybe frame why we did what we did and what we're due today, which is that several years ago, I was looking at the technology mental health industry, and I was seeing that some of the big companies out there you may have heard of, like Talkspace or BetterHelp or some of these remote psychotherapy platforms. And what I was seeing in the field was that they were moving more and more towards messaging-based care. So basically texting with people. And I was very skeptical. And I thought, does this really help? Is it psychotherapy? How do you do it? And back then, there was really no research on this to know if it did work. So some of my colleagues and I got together from University of Pennsylvania and University of Washington, and we really devised the first randomized controlled trial to test messaging-based care. And so we did over 12,000 messages. We recorded them all and coded them, and it was a very well-controlled study. And at the end, I was a complete convert. So I really saw incredible changes based on the care that we were able to provide with messaging only. And so to me, it was kind of a spark in my mind where I thought, in my mind, 2 of the biggest problems nationally we have with mental health are access and equitability and affordability of mental health care, because there's just simply not enough clinicians to meet the demand, especially given that the way mental health treatment typically has worked has been, we work with somebody for an hour a week, and then we see them in a week. And, that means we can see 30 people maybe in a week, and there's just not enough mental health clinicians. So with this approach, we launched this technology service called Trust with 2 S's. And the idea was to commercially scale a platform where we get experts on who can do messaging-based care. And one of the real interesting things we found was immediate uptake of youth. And of course, it makes sense if you think about how probably anyone on this call who has an adolescent, texting is really their first language, probably more than talking to you. So we rolled this out, and in the first 4 months that we'd rolled out the service last year, we were already in 25 states across the country. We will probably be in all 50 by the end of the year. And so it's now a service option for anyone, and you can actually use it as a consultation service, because you can even just bill by the week or bill by the month. And I will put in a shameless plug in here for Chris Seibel, who's actually one of our therapists on the platform. So we have probably at least 20 therapists who are very well known and all vetted and trained in New Hampshire. And we have probably 15 or 20 in Vermont as well. So just so people know, it is a resource, and I could say a lot more, but that's probably more than you want to know.
Well, thank you, Dr. Hudenko. And I did put the link in the chat so folks can go to the website and check it out to get a little bit more information about that. So the last question that I have for the group before we take a minute to open it up, and for our panelists, if you need to hop off at 8 o'clock, we respect that and thank you for your time. But if not, I encourage you to stay for just a couple more minutes. But my last question is for Willie. So during the film, Michael Phelps, he was on there talking to the young boy that idolized him, and he said the phrase that I enjoy: "It's okay to not be okay." So as somebody who is a 3-sport coach in the school, can you just talk a little bit about how you interpreted that? What does that mean to you? Yeah, those are my thoughts.
So I mean, I think the statement, the fact that he was speaking to a young child, he tried to put it as bluntly as he could, or well, as nicely while being blunt, of just, you have to be accepting of not being okay before you can accept help. You have to kind of admit that you have an issue, and it's okay to have these feelings, but you need to acknowledge them, and you need to address them, and you need to learn to help build your new neural pathways. And I appreciated that other group that talked about the breathing exercises. You can retrain your brain. And if you're having these intense anxiety reactions, learning what is triggering them, figuring out where your body is starting to react, you can learn how to control them. And I think that's part of what Michael Phelps was trying to lead this young person to realize, is that it's okay to not be okay, but learn how to accept help. And as far as, with how in my coaching, I really try to teach kids that just, it's okay to lose games. Not everyone wins in games. It's a matter of resilience, and you're gonna have someone who's better than you every once in a while. You can't win every game. You can't shut every opponent out. And I think that's, in some ways, allowing yourself to fail is a lot going back to the not enabling, not being failure resistant, I guess, was something that Dr. Hudenko was talking about a little bit. And I think sports is an easy way to start to develop that resiliency in a low stakes kind of manner.
Great, thank you so much, Willie. So with that, I think we can take just a couple of minutes to see if anybody on the call has a question that they would like to ask our panelists. Liz, I was looking through the chat, and I'm not sure I was seeing anything that people chatted in. So if you do have a question, feel free to raise your hand, or you can unmute and go ahead and ask your question. And no pressure if folks don't have any questions.
If it's okay. I was wondering, especially, I don't remember which one of you brought it up, but like the avoidance, and withdrawing from activities that used to be pleasurable. I was thinking about depression, which and what I've read is that anxiety and depression go hand in hand often. And I guess I'd be interested in if anyone has any thought. I mean, I guess the idea is that, you seek professional help, and then that professional can sort out, what's what and how to address what piece. But if anyone has any thoughts about that.
Well, I thank you for the question. It's a very good question. Oftentimes a presenting problem will be, I think I'm depressed, or my child's depressed. And when you seek out help, I think it's really important to seek out, someone who has some specialty in mental health. so that they can tease out the difference between a student who has depression and a student who has anxiety. I would, you mentioned it goes hand in hand. I don't know many anxious kids who don't have a level of, depressed feelings due to the inability that their life is being impacted by their anxiety disorder. So I guess to answer your question, I think it's so important just to have a really thorough evaluation so that you can tease out whether you're going to be treating anxiety or depression. And in many cases, you will be treating them both at the same time.
Thank you, Chris. Do we have any other questions?
I have a question. Several friends of mine have been struggling with how to manage their kids who are like at college age, so they're adults, tricky. But the kids, they wanted to show this film to their child who has anxiety because they thought it would be helpful, but they feel the part of the film where the student said, if you can tell people about your anxiety. And a couple of my friends have kids who it's kind of become their identity. It's like they get into a new group of friends in college and they're like, yeah, I've got anxiety. I'm super anxious. It's debilitating. And it's kind of a way to connect. And it's like people trying to outdo each other and wondering how to find that balance for parents to navigate that.
I could maybe take a stab at that one. So there is a balance there that I think you need to be thoughtful about, because I think we all feel as if it is good for people to be conversing about this and to be accepting of problems that they have. And at the same time, as you say, if it becomes reinforced in a way where there's no work on it, or maybe it even flourishes because it's too much of the identity, then that can be a problem as well. And so I guess one of the thoughts I would have about that is that in general, I think in mental health, we have worked hard as a community to try to even think about the nomenclature of mental illness, where we would say things like, this person has anxiety, instead of, this person is anxious, or this person has a substance use disorder, instead of they are an alcoholic. And I bring that up because I think that a good way to think about it is that if you have an anxiety disorder, that's a part of your experience, but it is not who you are. And I think there's a good way to have those type of conversations where it's a part of your experience, and you will have more problems in some areas than in others. And yet I think it's not potentially helpful to have that as too big of your identity, because then you're giving it too much, you're feeding it too much, and feeding it too much means it grows in a way that might actually be harmful. So I think maybe compartmentalizing it in that way and just reducing its intensity and your overall sense of self could be helpful. Now, how you accomplish that on a day-to-day basis is, a challenge, and maybe there's good guidance over time with someone to think about, how do I increase those other parts of my identity, which I think would be the counterbalance to that.
Great, thank you. I see Jennifer Chambers has her hand raised. So Jennifer, if you'd like to unmute yourself and go ahead and ask your question.
Thank you so much. Thank you for hosting this evening. My question is, in COVID land, where these kids, their whole life is online, what is your recommendation toward parents as far as social interaction versus like online, and what's healthy? Because pre-COVID, you would hope that they would like gather together and spend time interacting face to face. And right now, where the phones were already a problem, now it's like, great, do I limit my kid that like interaction that is their friends? I don't know. I feel like there's not a rule book for how to parent during COVID times. And I have 2 middle schoolers and would love any advice that you guys have. And it could be like, survive it. I'm okay with that. But right now I'm not, I have no idea.
Well, Jenny, I think your question is probably on the minds of all of us when it comes to our children, whether they're in middle school or college or elementary school. And there is no handbook. And it may be too cliche to say this, but it's that connection you have with your children. And to just be present with them and real with them and share your experiences with them as you're going through COVID. And I as a parent struggle mightily about the limits that I'm setting on an 18-year-old adult in terms of how often they get to go out and, are you wearing masks? Are you staying, there's a level of trust that we have to have for our children. And at the middle school level, it might mean there needs just to be more, orchestrated social time where, a parent might need to be involved, where they go to the field and they're playing a game where they're keeping their distance and they're wearing masks so that they can have that social connection. Dr. Chapman, he was really instrumental in having us understand how important it was to have kids back in school, and also not going back to school willy-nilly, but to understand there are risks involved that we can mitigate. And we've been back at school, September, October, November, and we've had very few cases. And I think if during COVID, you want to increase your kids' social activity, in-person social activity, there's ways to do that. And I would recommend that you follow some of the things that we're asking the young people to do while they're at school, because apparently it's working.
And Jenny, another thing in a resource I shared in the chat was from Dr. Midhu Stroni, was a speaker, one of the keynote speakers I was able to see from the Learning in the Brain virtual conference this year. And I pulled up my notes from it, and she really outlined the COVID stressors as being uncertainty, lack of physiological exercise, loss of meaning, and opportunity to recover. And I'm sure she talks about that in that podcast I shared, but she, points of just getting outside and that strictly indoor living is a big stressor, and that being able to have too much social distancing is a stressor. But, I can empathize with your struggle to sort of say, is the phone the social thing, or is the phone the thing that's keeping them from getting their other physiological needs? And I think that's a hard balance that I envy, or I don't envy you for that.
I'll add one thing too, because, running a tech company, this is something that I struggle with all the time, right? Because I think that there's really, really big and scary problems that are happening in the tech industry right now. And if anyone, a lot of people have been talking about The Social Dilemma on Netflix as a recent film, and highly recommend you see it. It's actually one of the most accurate representations of what's going on right now. So I would definitely check that out. But from my perspective, at our company, we all use the phrase technology for good. And the idea is that I think that there are real positive ways where we can help use the technology that we have to enhance mental health and other outcomes. And there's also real dangers. And on the danger side, I would say, it doesn't have to be an all or none, and think about no screens and, you guys are on your phones too much. But part of the answer might be, well, what are you doing on your phone? And what is it being used for, and for how much? So in terms of just overall use of technology and phones and screens, certainly, we have to have limits, because it's just not healthy. It's like salt, it's the spice of life, but at the same time, it's poison if you have too much. And then in terms of what are you doing, is it social media? Is that what you're really doing? Is it playing video games, or is it using Zoom? And I'd say of those options, if you have scheduled times where you're hanging out with your friends on Zoom calls and you're chatting, that's a more reasonable approximation of what you would do in person. Whereas if you're, on Facebook, or you're using Snapchat or something else, now there's more problems, I think, inherent to that. So I would just say, be thoughtful about how much, and then what is being done, and try to put, some boundaries on that, and then live through it. Because like Chris said, and we all said, these are unprecedented times, and we're all going to live through it, but it's hopefully, and it will pass.
Absolutely. I think we've got time for one more question, and I saw Laura Acker, I think you had a question, and I think we can take that now if you'd like to unmute yourself.
Thank you. This is so helpful. You guys have touched on so many things that I see. I was just kind of taking notes here, and I was my list was like, it's invisible, anxiety, relief, helpful, life-saving, the guilt, and then actually the last thing I came to was trust, which is kind of interesting, Dr. Hudenko. And I'm, we have a kid that has anxiety, probably a lot of us do, but I really thought when he was young, that he was just defiant. And it was so interesting to me when we saw a doctor and, the anxiety, and it just kind of all made so much sense. And, I was definitely the mom that was like, oh, let me make this easier for you. Oh, you don't want to ride your bike. It's dangerous going down the hill by the co-op. I'll drive you. And my husband's like, he can do it. He can do it. And, and just the guilt is so much. When our kid was going to see the doctor and talking about it, he said to me after one of the meetings that the doctor, who might actually be on this Zoom call, was almost as great as Abraham Lincoln. And as a parent, that was just so amazing to me. And he loved going. And then one day, I saw him kind of figure out that there was a stigma to it. Like all of a sudden, I think we must have come out and somebody saw him or something. And he didn't really know why we were kind of going. I mean, it's kind of hard. But like I saw him change. Like, how do you go from like Abraham Lincoln to then kind of like, I don't really know if I want to go. And so I wonder so much about how do you convince your kid that, like, how do you convince your kid that the stigma is okay? I mean, I myself, still feel that. I get some of my medications filled at Walgreens because I don't want to go to CVS in Hanover. I still feel it as an adult. And I don't know how, there's a lot of shame, I think, and I don't know how to convince my kid that the stigma isn't really a stigma if I can't even do it myself. And I don't know how to get rid of that stigma, because we are talking about it more. And I think that's great, but I still think there's just, for teenagers, and I went to Hanover High School too. I remember, Willie, you described my experience too. So I'm sorry, I didn't mean to talk so much, but like, how do you really convince your kid that the stigma isn't a stigma? And I don't know that we're addressing that well enough yet. And thank you. Thank you.
There is a great cartoon, a great graphic novel that was put out by the Center for Cartoon Studies, the mental health comic that addresses this idea of stigma really well. If you look at the Center for Cartoon Studies, you'll see they have a mental health comic available there. I'm pretty sure you can download a free version. I would share it with you, but I got permission to use it in health class, so I'm not sure that I have permission to share here. But if you can't find it there, I'm the counselor at Marion Cross, so you can reach out to me and I can figure out a way to get it to you. But it talks directly about the stigma and how hard that is being a part of our society. And the Center for Cartoon Studies just put that out a couple months ago, 2 months ago.
Thank you.
It's interesting. There's two reactions I have to what you say. The first is that the stigma isn't gone, and it is something that we're going to together continue to have to work on, I think. And this is a problem that we as a community, as a world, will continue to have to work on. And it is encouraging, I think, that youth are ahead of where we were back when I was younger, today. And it really caught my attention actually when Chief Frank before, she was talking about how I think she was helping somebody with Zoom, and helping them to become more comfortable. And I'm thinking, she's doing exposure therapy. She should be on the payroll. Like that. It's exactly the kind of thing that we would do. And it makes me think about how, this really is a community thing. It's not just the mental health clinicians, it's parents, it's the students themselves, it's how we talk about it, it's the messages we're giving people, that we all have this, I think, shared responsibility around how we make each other feel okay about these struggles that we all feel. So that was the first thought that I had. And then the second thought is that there is no substitute, I think, for experience, unfortunately, because a lot of why these things become stigmatized is misunderstanding. People, that's not their experience. They don't know what it is. They label it, they categorize it. So one of the things that I actually had happen on occasion when I was working more clinically was I would have students who would start to address the stigma in middle school and in high school and realize that they were ashamed to come see me and were worried. And I actually sometimes would have them bring their friends into a session. And so we'd have a group of, 6, them and 6 other people. And they were amazing sessions because for the first time, I gave them a platform to be able to talk about, here's what I feel like in these situations, like when I walk in the school and all of a sudden there's all these people and all their friends were like, oh yeah, I understand that. I get it. I see why you feel like that. And for them, it was so validating because their friends were saying, I feel that too sometimes. And so that shared communication, it was just amazing. And I think having these kind of forums, making it more public programming, talking about it in schools, talking about it here, I think it's great. And I hope we continue to do it.
Thank you so much. So with that being said, I think, did I miss any other questions?
There's one more hand right now. I don't know if we have time or not.
Let's see.
It's me, Jen. I just have I was just thinking about back to what Cindy said, and I think that as adults that we need to step away from this whole cult of overdoing and stress. And that's, to me, part of what can help contribute to anxiety in kids and in other adults around us. That not feeling like we have to be busy all the time, that somehow busyness is like a status thing. So I just thinking about what Cindy said, that was the first, just something I wanted to comment on, that I think that we need to model slowing down and taking care of ourselves and not contributing to stress in an unhealthy way.
Thank you, Jen. I think that's great advice, and I think the perfect way to end this session. But before we do end for good, I'd like to just ask our panelists in 60 seconds or less, what is the take-home message that you would like to leave the audience with? So I will just go ahead and start with Willie.
I think one take-home message I would say is, help your children learn some skills to deal with this. And I think there are ways to manage things, and there are ways to help diffuse situations that as soon as they can start to recognize it within themselves and learn how to live within themselves and be okay with themselves, that'll pay really big dividends in being able to allow them to self-actuate. I kind of tend to think of Maslow's hierarchy of needs, and that next level is that right before the self-actualization is the esteem, and just helping give them that understanding that they need to build that esteem themselves in order to get to that place.
Great, thank you. Chief Frank, your take-home message that you'd like to leave people with?
To practice those skills even when not in crisis. It's what I often talk to my police officers about. We do a yoga class once a month. And I know that sounds strange that police officers do yoga, but we do. We meet with a nutritionist once every 3 months. And the reason for that, and we debrief and we talk about some of the things that we see and experience, because we do have a unique perspective on the world given the calls that we respond to. And I explained to them that I want us to debrief and work through some of these counseling sessions, even when we think we don't need it, because there's going to be a time that you might need it. And we want it to be situation that you're comfortable with, that you've experienced, and it's not something new. So if there's a skill or a technique that you find that works, use it even when that crisis isn't existing.
Perfect, thank you. Dr. Hudenko, your take-home message, please.
Yeah, I think my take-home is that I believe that anxiety is really a story of hope. And I think it's a story of hope because anxiety is an experience that connects all of us. And in other areas of mental illness, you know, you might not have ever struggled with your gender identity. You might not have ever had a problem with, you know, severe OCD, but everybody experiences anxiety. And I think that means it's a unique opportunity for us to connect with each other and understand what that experience is like at some level. And then it's a very treatable thing for most people. And that's an exciting thing to me, that I think for a lot of people with anxiety, there is great hope out there and tools you can use and things to learn and people to connect with. So I like this discussion, and I like that this movie was proposed because I think it opens a good dialogue for all of us around how do we support each other, especially during this really challenging time that we're all living through.
Great, thank you. And finally, Chris, your take-home message for the audience, please.
I'd like to thank you, Andrea, for organizing this and hosting it. You did a terrific job, and it's great that we're coming together and talking about mental health and how it impacts, or mental illness and how it impacts our children. I also want to let people know that Frida Meehan, Jen Gantrish, Liz Powers. I mean, there's maybe other people I'm missing. I can't see everyone's face. Laura Aka. I mean, they're all part of our Circle Up parent group in the Dresden School District. And I want to thank them as well, because a lot of, late evenings on a Tuesday night when we've worked all day and cooked for our children, they're getting together and they're organizing presentations such as this. And this is one in probably over the last 10 or so years. This is one in about a couple of dozens that they've done. So I want to thank them as well. My take-home message is anxiety is treatable, and you just got to get in there. And at times it's a struggle. And anytime you're in a struggle, it's so helpful just to have a team with you, and not go on your own, and don't isolate, because then that struggle gets even more challenging. So there's definitely treatment, there's definitely recovery from anxiety disorder, and there's a lot of us out there that are managing it, and you don't have to feel like you're alone.
Perfect. Great way to end it. So with that, I think Chris and Liz already gave our thank yous in the chat and on here. But again, I'd just like to thank Mary Lockhart and the Howe Library, and again, Circle Up, and especially all of our panelists for taking the time tonight, giving up your evening to join us and have this conversation. So thank you, everybody, and have a great night. And I hope this was helpful.
Thank you.